You are listening to Skin, Earth, Vitality, the podcast where ancient wisdom meets modern vitality. If you are seeking to reconnect with your innate vibrancy, you're in the right place. I'm Emily Davis, a seasoned holistic esthetician and herbalist. Join me as we unlock the secrets of ancient skincare practices, explore the beauty of seasonal and nature-based living, herbalism, and true holistic well-being for you and the broader ecosystem. Welcome back to Skin, Earth, Vitality. This is episode 35, and today I want to chat about microneedling, which is also sometimes called collagen induction therapy. And I'm going to talk about how I approach it in my practice from a holistic lens. This episode is for you if you're interested in receiving this treatment and want to learn more about it. And then I also know that I have many estheticians who listen in and who are maybe interested in learning more about my approach to microneedling. And I will say I have taken 4 separate trainings on microneedling over the years. I've been practicing this treatment for about 8 years now. And unfortunately, there is so much that I didn't get in all 4 of these trainings that I've gotten outside of the trainings. And so that is to say, number one, listening to this is certainly not going to be enough to give you what you need for practicing this treatment professionally, of course. There are different regulations state by state as to who can perform microneedling, who cannot, whose scope of practice it's in, and what type of training you need to get. And then additionally, you want to make sure that you're fully insured and that you meet the requirements for training for your insurance. So on top of all of that, I would highly recommend reading the dermal needle or the concise guide to dermal needling by Dr. Lance Setterfield. And then there's another book that I really like called Holistic Microneedling, the Manual of Natural Skin Needling. Now, there's a lot of things that I don't agree with in the Holistic Microneedling book, but it's a great way to maybe get some other ideas outside of the conventional medical aesthetics view on microneedling. And then in addition to those books, I highly recommend for estheticians checking out the education provided by Entourage, which is a professional skincare company. I'm not crazy about their products, honestly. They do not fit into my philosophy of skincare, but they do microneedling really well. And then in addition to that, Herbal Skin Solutions has some really great microneedling education for estheticians. So I just have to throw that in there because I know I have many estheticians listening. But this show is primarily for the consumer who's interested in receiving microneedling, and maybe you want a deeper dive on it to really understand what's happening, or maybe you've received it in the past and you want to know more about what happened when you got it. So I'm going to lay out why microneedling is part of my skin philosophy, whereas dermaplaning or hydrofacial are not. And with that being said, I definitely don't recommend microneedling to everyone. I honestly don't advertise it that often because it's not for everyone. And I really like for it to be a conversation between myself and my client rather than people just randomly booking it. So this episode is really meant to serve as a deepening into that conversation. I'll be talking about what microneedling is, what the benefits are, who is a good candidate, how to know if you're not a good candidate. I want to specifically get into mindset and intention here because that is so important when talking about this type of a treatment. I want to talk, of course, about the contraindications and informed consent to any treatment means that you're walking into the treatment with your eyes wide open. So I'm also going to be talking about potential side effects that can happen from microneedling. And I want to discuss how you would prepare for the treatment, what the post-care looks like, and then I'm actually going to get into what's happening in your skin up to a year after the treatment, because people are often talking about how you're building collagen for a year after. So I want to just get into what that actually looks like. And then finally, I'm going to talk about why doing multiple treatments is going to be ideal for the best results and most effective treatment. So let's first get into what microneedling actually is. It's a cosmetic treatment and it utilizes fine needles to puncture the skin, which is going to create a micro injury in your skin. And the roots of utilizing needles for both healing and for cosmetic purposes, which can be one and the same thing, but the roots for this can be linked to traditional Chinese medicine and the use of needles for acupuncture. Of course, these are completely different treatments. They do different things, but they do share the same lineage, which is why this treatment is also performed by acupuncturists as well as estheticians and dermatologists. So this micro injury that we've created stimulates a healing cascade. So our wound healing happens in 3 different phases. The first phase is inflammation. So we've created acute inflammation in the skin. As the needles are entering the skin, they're rupturing blood vessels, which can cause both blood and serum to flood the area. So there's generally a small amount of blood, and it may not be visible, but this blood vessel damage below your skin releases what are called cytokines. And these are what create an environment for smooth, healthy healing. But this doesn't mean that the skin needs to be super bloody, because the smallest blood vessels are actually located within 0.2 to 0.5 millimeters from the surface of our skin. So this is to say that a superficial needle can create beautiful results without unnecessary inflammation. And so if you're not familiar, there are different needle depths that you can go, and it's often seen in conventional beauty. I mean, it's just human nature, right? Like more is better, more aggressive is going to lead to more effective results, but that in itself is just one reason as to why that's not necessarily true. So immediately after the injury, the cell membrane releases factors that cause vasoconstriction to the blood vessels. And this is to prevent excessive blood loss. And that happens for about 5 to 10 minutes. And then at about 20 minutes after the treatment, vasodilation peaks, which is caused by the release of histamine. And so this is why your skin is going to look the most red about 20 minutes after the treatment, which is usually around the time you're leaving. And so you will see that your skin is quite pink. It could be quite red looking, and this is the erythema after the vasodilation. So because of this histamine action that's happening, your skin can also feel a little bit itchy right after the treatment as well. So that's the inflammation phase. And the next phase of wound healing is a couple of days after, and this is called the proliferative phase. So fibroblasts, which are the cells that create collagen, proliferate in the area, and they're producing the first type of collagen, which is called type 3 collagen. And this type 3 collagen is very flexible. It's not super strong. It's like the temporary scaffolding that's a placeholder that's able to be really quickly produced. It's thin, like I said, and then in the third phase of wound healing, or this healing cascade, is when the maturation or remodeling phase happens. And this is where a different type of collagen called type 1 collagen is formed. And this is more strong, durable, a permanent form of collagen that really reinforces the healed tissue. So the goal in microneedling is to stimulate both collagen types to improve your skin's texture, its firmness, and in this third phase is actually when elastin fibers are produced to restore the skin's elasticity or flexibility. But that's not all that happens. Actually, the tiny micro injuries that are created by microneedling can also stimulate the breakdown of clusters of hyperactive melanocytes. You may remember those from my hyperpigmentation episode. So these are cells that are responsible for melanin production in the skin. This helps disperse and break down concentrated areas of pigment, so like a sunspot or post-inflammatory hyperpigmentation. Additionally, this process stimulates cellular turnover, which means the old pigmented cells are gradually replaced by new healthy cells. Over time, as the skin regenerates, the melanin that's trapped in the layers of the skin is pushed up to the surface and naturally sloughed off, which is going to also reduce the appearance of hyperpigmentation. This skin cell turnover is also why you might see a little bit of peeling in the days up to a week, maybe after the treatment, because it's stimulating that skin cell turnover, which means cells at the bottom are traveling up to the surface and gradually pushing off surface cells. So we see that not only collagen and elastin are created through this healing response, we also have new, healthier blood vessels that have been formed, which is going to mean better flow of nutrients to the skin. This treatment also releases substances that are called growth factors, which play a crucial role in our skin cells' ability to talk to each other, which is also known as our cell-to-cell communication. So this improved ability to talk to each other is going to improve the integrity of our skin. And with this improved communication, it's actually also going to improve the integrity of the skin's barrier. It can also help to reduce chronic low-level inflammation. And I think this is so interesting that it's causing acute inflammation, but in the long run, it's actually reducing the low-level chronic inflammation, which is really what we want. But let's talk a little bit about why I see microneedling as a holistic modality. Not all microneedling is, but it can be, and I think really if you're a purist with it, then it actually really is. So from a conventional medical aesthetic lens, microneedling has really gained a reputation as a quick fix, quote unquote, quick fix for wrinkles and scarring and uneven skin tone. But I feel like approaching this treatment solely as a way to erase your perceived flaws really distorts the potential of microneedling. Of course, I believe that the intention behind any skincare treatment is as relevant, if not more so, than the treatment itself. And for microneedling to truly support skin health, I would consider reframing it from being a way to fix imperfections and then look at it instead as a tool for enhancing the vitality and promoting our skin's natural regeneration process and really promoting the skin function in itself. It's often used to go deep in the live layers in like a medical aesthetics setting. And I really feel like that's creating unnecessary and problematic inflammation. And I feel like instead of committing violence against our skin with an attitude of like blasting wrinkles away, I focus on a progressive method that works with our skin's natural healing process. I really believe in a gradual, gentle treatment that encourages long-term improvement without overwhelming it. So I really stand on like a progressive versus aggressive route, where in an aggressive route, you're aiming for quicker results. You're in that mindset of like more is better, more aggressive is more effective. And so you're using like a longer needle to get that quick fix, but you're really risking, again, unnecessary inflammation, in my opinion. Okay, so let's talk about why I do microneedling versus why I'm not a fan of dermaplaning. I think I'll do a whole episode on dermaplaning. I wrote a Substack article called Why I Shaved Dermaplane from My Service Menu. You can look that up in my Substack. But microneedling is much different than dermaplaning or hydrofacial or chemical peels, because the latter treatments are actually removing layers of the skin. They are completely taking off the barrier. They're completely taking off the surface microbiome and the surface stratum corneum cells. And I say that the microbiome like lives all throughout the skin, but there's a lot on the surface. And so they're taking off that whole surface. So imagine like ripping up your whole lawn versus aerating the lawn, which is like what microneedling is doing. It's leaving the barrier intact. It's leaving the stratum corneum intact. And then the stratum corneum are the surface, like quote unquote dead skin cells, and those have been seen as like totally innate, but they're actually very functioning. They're very important to the cellular communication to cells below the surface to kind of let them know what's going on up here. How do you need to prepare? So when we're just blasting those away, we're really messing up the skin and setting it up to have future problems like acne, dehydration, premature wrinkling, other issues like dermatitis, things like this. So I'm not a fan of just totally blasting the surface away. Microneedling doesn't do that. Okay, so who is a good candidate? Microneedling can be really beneficial, of course, for anyone who is interested in stimulating collagen production, improving the appearance of fine lines, enhancing skin texture and tone, and supporting the skin's natural functions. However, those who will benefit the most are people who understand that microneedling is not a one-time quick fix, but it's part of a approach to long-term skin health. And an ideal candidate is someone who has intact, healthy skin and maintains a lifestyle that supports overall wellness, which includes low levels of inflammatory habits. Someone who's not a great candidate for microneedling may be somebody who engages in a highly inflammatory lifestyle. And this includes those who experience high levels of stress. Also, somebody who has been recently sick. Someone who consumes a diet rich in processed or unhealthy foods. Someone who drinks alcohol frequently and participates in other habits that contribute to inflammation. None of this is a judgment on morality, obviously. It's just that the skin is not going to be as intact and the healing response isn't going to be as good. And so it's like, why spend the money, first of all, and why put your skin through the ringer? It's not a gentle treatment. And so why do this when you're really not going to get optimal results? For optimal results, it's best for somebody to really prioritize a balanced lifestyle in the months and weeks before getting into microneedling. So I want to list off all of the contraindications so that you are aware. The first one is any active infection. So any bacterial, viral, or fungal infection. This can look like herpes simplex, or it can also look like active acne. And so you really want to avoid this treatment if you have any current active infection. The next is severe skin conditions. So eczema, psoriasis, rosacea, these are probably not the best candidates for microneedling. Next is blood disorders, so hemophilia or any other bleeding disorder that can affect the way that the blood clots. Any recent cosmetic procedures. So this looks like a chemical peel, a laser treatment, or any other invasive procedure. You definitely want to wait until the skin has fully healed. I would say a minimum of 6 weeks. The use of certain medications like isotretinoin or Accutane or any type of an anticoagulant that can increase the risk of complications is not a good candidate. A history of keloid formation or abnormal scarring may actually increase your risk of adverse effects. Any type of sunburn, if you've recently gone tanning, don't go get microneedling afterward, of course. Immunosuppressive conditions. So this can look like cancer or an autoimmune condition, especially if you're currently having a flare. You may be at a higher risk of infection or delayed healing. Uncontrolled diabetes can also really impair the healing process. An allergic reaction, and then also recent vaccinations, because this will temporarily compromise your immune system. And so doing any type of a treatment where we're creating a controlled injury is not a great idea in the days after. Okay, so what can you expect from a microneedling service with me? As with all treatments, microneedling is going to be approached with a lot of reverence and a lot of intention. So it's really important, if you're coming to me for a microneedling treatment, to be aware that if your skin's not in an optimal condition, or if we are talking and it kind of feels like you're not the best candidate for microneedling at this time, I may opt for a supportive facial. My number one priority is always the integrity of your skin and the health of your skin. So be aware of that. They perform exclusively with pure hyaluronic acid, which is a substance that's already naturally occurring in your skin. And for any esthetician listening, that doesn't mean just your hyaluronic acid serum from the product company that you're using. It needs to be a microneedling solution with pure hyaluronic acid. Anti-Age makes a great option, and that's the one that I use. I have gone back and forth throughout my career on my position on bone marrow stem cells. So these are stem cells from bone marrow, which is like our body's master healing cell. And they come in a little tube. And I've gone back and forth because sometimes I'm like, is this marketing hype? How is a bone marrow stem cell staying viable within this tube and not being refrigerated? But as I've done more research, I've learned that it's not necessarily like that specific stem cell is entering your skin and it's the one healing it. what it's actually doing is promoting production of your own stem cells. And so at this point in time, I am using them if it's appropriate in that particular situation. So sometimes I use them, sometimes I don't. For some people, I don't feel like it's necessary. I had a client who was in her early 20s and her skin was really good at healing because she was really young and we didn't use the stem cell. And I actually saw better results with that treatment than I have in any other treatment where I have used the stem cells. So I kind of just go back and forth deciding if it's appropriate with that client. But other than that, I don't use anything else on the skin. The hyaluronic acid provides hydration to the skin, which is going to allow for a smooth glide of the microneedling pen. Other serums or oils that are not specifically made for microneedling, so if it's just a serum from a skincare company like a hyaluronic acid serum, I don't recommend it because when non-bioidentical ingredients, even if they're natural, but even like SPF afterwards, a mask afterwards, if any of these things are applied to the skin during or after microneedling, they can be perceived as a foreign substance by the immune system, and this can trigger an inflammatory response leading to the formulation of what's called a granuloma, which is like a little nodule or a bump in the skin, which is the body's attempt to isolate and eliminate that perceived threat. So because of this, I actually recommend not to apply anything to the skin for 24 hours after your treatment. You'll leave the treatment with nothing on your skin, no SPF, which is why I recommend bringing a hat to your service to wear afterwards. And of course, we'll get into the post-care, but you want to avoid any sun exposure to the skin. And the reason is this 24 hours is to ensure that the channel has fully closed. So this healing process is incredibly delicate, and this is where I feel like the body producing substances like the cytokines, like the growth factors, are far superior than any synthetic product that you can put on it. And this is really a time that I feel that you can trust the magic of the repair process, the magic of our body. I do pair my microneedling treatments with both LED light and lymphatic drainage. So this combination enhances the overall benefit for the skin. The LED therapy is going to help further stimulate collagen production and accelerate the healing process, while lymphatic drainage is going to promote circulation. It's going to reduce inflammation and aid in optimal hydration. And like I said, there are potential unwanted effects like temporary redness and irritation. You will leave your treatment with very irritated feeling skin. It may feel raw, kind of feels like a sunburn. You will experience dryness and peeling as the skin heals. Like I said, we're stimulating that skin cell turnover, and so there may be some shedding of skin. And then the risk of infection if the procedure is performed in unsanitary conditions, or if there is a current infection happening, if you currently have acne. I'm not a fan of doing microneedling over acne. I know that some people do, but I think it causes potential risks that aren't really worth the benefit. I'm a much bigger fan of repairing the barrier first and then going in with the microneedling for scarring afterward. So how you would prep for microneedling as a client is to, number one, discontinue consuming alcohol in the days leading up to the treatment. You want to also reduce inflammatory foods, consider protein-rich foods to gear the body up to heal. I would also consider reducing your stress levels, maybe thinking about how meditation or breath work can be a part of your life. I recommend this always, but our mind has such a powerful effect on our body, and when we're going into a treatment where we're creating a controlled injury, we really want to give our body the best building blocks that we can. You want to, of course, discontinue the use of harsh exfoliants like acids and retinoids, even at least 5 days before treatment. For retinol, I would discontinue for 2 weeks prior to treatment. Hydrate the skin thoroughly in the days leading up to your appointment, because healthy and well moisturized skin will respond better to the treatment. This is why I do not exfoliate prior. I only cleanse the skin and then we move into the needling after that. Avoid excessive sun exposure and protect your skin with mineral sunblock. Again, a tan or a sunburn is not a great way to come into a microneedling treatment. And in fact, I would not perform the treatment if that were the case. So for post-care, you want to make sure that you're not touching your face at all. You do not want to introduce bacteria to the skin when it's freshly injured. And so thinking about your glasses, you definitely want to sanitize them before putting them back on if you absolutely have to wear glasses after. You want to wait 24 hours after the treatment to cleanse or apply any product. Avoid intentional and direct sunlight for 72 hours after. The big one for me that makes microneedling hard is you need to avoid exercise or anything that's going to heat up your body, like a sauna, steam room, hot bath, hot shower, hot tub. You want to avoid that for 72 hours following your treatment. You want to avoid chlorinated water for 7 days post-treatment, so don't go swimming after. Do not use any type of exfoliation for at least 7 days after your treatment. And then products that you utilize during the healing time should be gentle, hydrating, antioxidant rich. I always give my clients Laurel's Recovery Balm after, because it's such a beautiful product in the days after the treatment. You definitely don't want to do any waxing in the treated area for at least 14 days after. And then don't do any type of microdermabrasion, hydroderm, peels, dermaplane, microneedling again for at least 6 to 8 weeks after the treatment. Following proper pre-care and post-care is so incredibly important. You're putting a lot of investment into this treatment. You are doing it because you want to improve the appearance of your skin, I'm assuming. And so if you're not following this pre and post care, you're really just throwing your money down the drain, and you're actually risking causing complications that will cause bigger problems with your skin and can also affect the appearance of your skin. So really be a stickler about that stuff. It's so important. It's not something to be flippant about. So what happens in the year after just one microneedling session? Our immediate reaction, which is within the first 24 to 48 hours, is that inflammatory stage. So the skin is red, it's swollen, it's inflamed because blood is rushing to the treated area. And then the wound healing begins. Both platelets and growth factors in the blood start to work on repairing these micro wounds. And then from days 3 to 7, this is when our proliferation phase happens. Some say it can happen up to day 10. So after this inflammation happens, we're going to now begin the repair. This is where collagen and elastin start to form. And we also have the new skin cells that are generated that are gradually replacing old and damaged cells. So from week 2 onward, we have what's called our remodeling and maturation phase. Collagen type 1 is now produced, and then we also have an increase in elastin. So in that week 2 to 4, we have improved skin texture. Our skin is beginning to look smoother and maybe firmer. There's going to be really no redness left at this point in time. Our irritation has subsided and the skin is healing. And then in months 1 to 3, our collagen is beginning to mature. Hyperpigmentation or uneven skin tone may start to fade. So I think it's really important that we're seeing this 1 to 3 months after your treatment. So it's really unrealistic to expect one treatment and then a week later hyperpigmentation to be gone. Our long-term remodeling is happening in about 3 to 6 months after the treatment. So scarring may be less pronounced. Our collagen is continuing to rebuild. Our skin tone may be further evening out. And then in months 6 to 12, the skin's barrier has become stronger and overall skin health has improved. So we're going to have the best long-term results if we have more than one treatment. So 3 to 6 microneedling treatments are typically recommended over a single session because the skin's healing and collagen production are cumulative, meaning that multiple treatments build upon each other to achieve the best results. One session might not be enough to provide enough stimulation to fully remodel the skin because each treatment is going to help break down scar tissue, smooth out the skin's texture, and promote collagen. So today we talked about what actually happens within the skin with microneedling. We talked about why I feel like microneedling is a holistic treatment and why it fits into my personal skin philosophy. We talked about who a really good candidate is. We talked about contraindications, who's not a great candidate, and then also adverse effects that can happen afterward. We also talked about how to prep for microneedling, the post-care, what happens in the year after the microneedling treatment is done, and why I recommend 3 to 6 treatments over just one singular treatment. I hope that this has been helpful. If it has, please share it with a friend who you think it could also help. It really means a lot to me and helps the show to grow, which is obviously the goal here. And if you could pop in and give me a 5-star review on Apple or Spotify, that would be so lovely. And I will be back next week. And until then, be well. You've been listening to Skin, Earth, Vitality. If you liked what you heard today, consider giving me a 5-star rating. It helps other people just like you find the show. You can shop products and find all of my offerings on my website, stratumaesthetics.com, and follow me on my social channels at Stratum Aesthetics.